When you win your primary in Georgia, you have almost certainly won, except in a handful of districts. So these folks have to contemplate two questions: what's right for Georgia and what will get me reelected or unelected. And we cannot separate ourselves from that reality they face. Let's say I'm a senator. I'm going to play their side for a minute. They're a senator. They want to get reelected. They ran on education. I want to do something on education. They're being asked to vote for something in this example in the healthcare space, like a tobacco tax. Hey, I think that might get me unelected. Andy, you're right. But if I vote with you, I compromise my ability to get reelected, which compromises my ability to do this education thing that I ran in the first place for. I'm not going to sacrifice my election at the altar of your tobacco tax when I don't think that the votes, even if I vote with you, you probably don't have the 91 votes you need to get it out of the House anyway. So why would I die on that hill? These are pragmatic, real considerations that we have to account for. This is not for us just about being right. This is not for us just about having the right policy arguments and the data to corroborate them.
What's the hope? Where's the hope?
Thanks for bringing me back to reality.
The point here is know your audience. And our audience with Republicans has to do as much with budgetary stuff. And let's respect the fact that they do have to work under a balanced budget cap. And they will ask you the questions. Andy, I agree with you. Where do you want me to take it from? Do you want it to come out of childhood cancer? There are other good causes out there that we have to fund in Georgia, and education itself takes up over half of the state's budget anyway. So what do we do about that? Madison, it's an excellent question.
Yeah, I have only excellent.
And I'm glad you invoked that. Here's what I will say. Here's another part of the playing field that we're dealing on. And I'm trying to be pragmatic, and I'm painting a little bit with the broad brush here, but given that I only have 2.5 hours, I got to get it all in. It's like trying to get 10 pounds in a 5-pound bag. So here's what that's so here's what we have learned with some of our off-session meetings with both House members, Senate members, the executive branch offices. One of the things that we have learned is both parties, of course, when you're coming up on an election cycle, and the session that we will hit in January will be the one that precedes the next election cycle, of course. All of our members of the House and Senate are voted in every 2 years. So one of the things we know they both do is they both do a lot of polling because they want to know what people want to hear so that that's what they can tell them. One of the things that we have learned from many of our Republican allies who have been very supportive of our agenda in the past is that, as we all know, 2 cycles ago, so about 2.5 years ago, suburban women, this was the moniker put on it, right? Suburban women were going to determine the outcome of the elections. And both parties were like throwing everything they could at the ball. Whatever you got to do to get suburban women there to swing vote, that's who's going to win, right? Suburban women, all of a sudden the power ascension was just off the charts. Both parties wanted to worship at that altar. So we did that, and we had a number of really great Republican allies step up and do things like extend postpartum Medicaid from 60 days to 6 months. And we came back the next year and took it to 12 months. We went from 60 days to 12 months. I would say to you, and that, again, I mean this broadly, and there's some nuance. I would say that happened because of the political conditions, right? It wasn't that like people suddenly woke up and understood. It was like, oh, we got to do something for women. They're the swing vote. So we have to be able to avail of the political currents that are emerging. And so it is always part of our job, certainly my job and Madison's, to make sure we understand what those political currents are. Here's one of the political currents, 2 political currents going on right now that are amazing for us. That was why I was saying earlier, I'm so glad to see such great turnout because we've got a great opportunity. One of those political currents is, and again, take all politics out of this. I'm a lobbyist. I just count votes, right? Like there's 180 members of the House. We need 91 of them. We can lose 89 times and still win. I'm a bean counter. I need 91. I don't care what ratio of Republican to Democrat they are. We get 91 votes on the House floor, we win. In the House, we get 29 votes on the Senate floor, we win. That's our only game. We don't care what party they're from. That's the number that we have to get to. So these are the 2 trends going on right now. So I talk with Republicans across the state, elected Republicans across the state. What they say is this: hey, we really thought that the debate, that the Dobbs debate, that the overturn, we knew it was going to hit us, but then we thought it was going to taper and wane. Now what they understand, we saw this in the Ohio referendum even a couple of weeks ago, it did not wane. I'm not asking for anybody to weigh on this issue. Again, it's irrelevant for our purposes, other than it informs some things. So what Republicans are now seeing in their own polling is, this is not going away. Like, this wasn't the surge of uprising that then reset to the default. So they're going, this is not playing well for us election-wise. So this puts them right back in the posture they were in 2.5 years ago. And again, I want to be clear, I'm painting with a little bit of a broad brush for time's sake here, but it puts them back in the posture that they were a couple of cycles ago, where women and suburban women and the swing voter women, moderate women, whatever the moniker is they're using in their polling, have again ascended to a very, very key demographic that's going to swing some votes. Republicans want to recapture some of the votes that they are going to lose as a result of that Dobbs decision. However you feel about that, they know they've got to account for it. Democrats are trying to avail and keep the tailwind going from that decision. And who is at the intersection of those? It's, of course, women, right? So we find ourselves at this place where moderate suburban women and women in general have again ascended. This means that your voice has an outsized footprint right now to legislators. You are one of your demographic, the demographic that is sitting in this room has an even more outsized voice than you would routinely have. This has winded our back. Compounding that favorably for us is that, I don't know how many of you all track it all, kind of the monthly revenue figures, but Georgia's revenue figures, even through COVID, were dramatically outpacing projections. To your point earlier, Karen, dramatically outpacing projections. And the report just came out this last month. We just had one of the best months year over year that we've had in 2 years. Our rainy day fund is full. We have got billions of dollars, literally, sitting in a rainy day fund and revenues that continue to look good. And to me, what this says is, so we have a demographic that is represented at all of these tables and online today that is got a lot of capital to use right now. And we have the money in the state budget to do things, put those things together, and we have the formula and the ingredients for a very effective year where we should be collectively, in my opinion, ambitious about our goals with maternal mortality, with child mortality, with women in the workplace, with equity, with across the board. Women's issues are poised this year. They are primed. We have opportunity. This leads to our last stage. I know you're about to ask about that. So our last stage is, how do we do? So what do we do with this information? What do we do with these currents? What do we do with this tailwind, so to speak, that we have with regard to appropriations and demographics? What we have to do is get really, really organized and also really, really specific. And what I mean by that is we have to collectively say, what are our priorities? In a detailed way, not just like, yeah, we got to just have more balance for women. That's not a bill. What do we have that can be written into a piece of legislation that says, here is a specific, quantifiable, measurable objective for maternal mortality? What's it going to cost? What agency is going to run that program? How are we going to get money out to the community? That can be CHWs. It can be any number of things. So we can have a whole lane there. We can have a whole workplace lane. How do we make sure that pregnant women in the workforce are treated fairly all the time, every time in Georgia code? How do we make sure that the Georgia code reflects the priority of women in the workforce in specific terms? And once we identify those priorities, we go to stage 2 of our last phase, which is to say, everybody in this room probably represents an organization as well that has, you're here for a reason. And it might be your personal investment, it might be your professional investment, it might be both. But we all have a stake here. Everybody in this room, at a bare minimum, has a rep and a senator, right? Everybody in this room does. And so what we want to do is craft not only what our positions in very specific terms are going to be, but who is going to implement those? How do we have a division of labor to where we say, hey, we got nobody in Camilla, but we got a key member of the committee that's from Camilla who knows somebody in Camilla that we can like get to this work. We must have a division of labor organizationally and individually so that we can more specifically attack this problem. So I mentioned before in the House, there's 180 members, we need 91, and that's true. You got to have that to pass it off the floor. But even before you get it onto the House floor in this example, you got to go all the way through the committee process, right? And on a committee, there might be 19 members, which means you need at least 10 of them to vote yes. So what happens if me and Madison go do a vote count of that committee for a very important bill that we want to work on? And we say, okay, we've got 8 for us and 8 against us and 3 on the fence. Guess who we're focusing the 3 on the fence? And we say, where are their districts? Alpharetta, Camilla, Savannah. Who do we have in Alpharetta, Camilla, and Savannah? Let's call them now, ask them to render this call, to send this correspondence, to do whatever. This is the type of granular division of labor that we have to have collectively in order to be the most successful. We got to get bills out of committee so that we can get them onto the floor. But even underneath that dynamic of vote counting and doing direct outreach to our legislators, there are other things that each of us can do individually, organizationally. For example, can we say we want 15 letters to the editor by the end of this calendar year, and we want them in these papers? Who do we have in those areas that we can co-draft a letter to the editor with, for example, and then have somebody place that in that key legislative paper? I think Madison had a question, I think. Do I see her hand up? I do. So I'm out of time. So, all right, here's the last thing. Here's the last thing I want to do really spontaneously. And if you've ever played this game before, please don't play. But I want to show you, like, so on one level, here's the last thing I'm going to say. I told you I was trying to get 10 pounds in a 5-pound bag. And I always do this to myself. But here's what I want. Here's one way I want to kind of illustrate that. On one hand, politics is very complicated, and you got to go through this system and this committee and this subcommittee and get this vote. And there's all kinds of gymnastics you have to do. And in that sense, it can be complicated. In another sense, though, it is enormously simple and intuitive. And that's what I want to illustrate here, because if nothing else, in the very short amount of time. So what I want to show y'all, again, don't play this if you haven't before. I'm going to show, I just wrote a 4-letter word on this piece of paper. And I'm going to show you all this word. I'm going to hold it up and show it to you. And when I do, I just want you to say this word, right? And then I'm going to hold it up a little bit higher. And I want you to say this word again a little bit louder. And then I'm going to hold it up over my head. And I want you to basically yell this word. And then I'm going to have a quick question for you. Y'all got that? Are y'all ready?
Stop. Stop. Stop.
What do you do at a green light?
Stop.
What do you do at a green light? Say it like an advocate.
Go. Go.
Go at a green light. You don't stop at a green light. And everybody knows that. But here's what I just did. I put you all in a state of mind. I got y'all to repeat something just very briefly. And then you reflexively rendered an answer. In the most simple sense, if all you can do is make a call to your legislator, and we call them enough times about the same bill from multi-organizations, and they hear over and over again, do this, do this, do this. We need your vote. We need your vote. We need your vote. At the end of the day, we win votes that way. Sometimes it really is repetition. And I say this to say, you don't have to be an expert in all things legislative to call your legislator. You don't. You're just a constituent. Hey, I care about the subject. I hope you're going to vote with us on this bill. Repetition matters. Call volumes matter. Walk to the Capitol with me. Walk into an office and look at the tick sheet on every bill that every admin of every rep and senator has. How many calls have we gotten today on House Bill 314? 35. How many for, how many against? 20 to 15. That's what that legislator wants to know. It matters, and you can do that. Everybody in this room can at least render that call. But we can also work with you to write op-eds, to write letters to the editor, to come render testimony in committee. Bring your story. Do you have a maternal mortality story like a woman I met yesterday at Emory? Bring it to the Capitol and share it. It will be well received. You don't have to be a political expert to do that. Your expertise is in maternal care, not politics. They don't expect you to be. Don't be afraid. Contact your legislator, come to the Capitol, participate in a press conference, write a letter to the editor. There's something that for all of us to do that will move this needle, that will get Georgia out of 49th place in maternal mortality, for example, and the rest of our agenda as well. So sorry to go over time, but that is the gist of it. We all have a role to play. We can make this happen. The tailwinds are behind us this year. It's not always that way. We got to do it this year. We got to hit it hard this year. Thank you all for
Honestly, your extra few minutes were worth it just to watch Kai constantly yell stop.
Oh, I didn't even hear that.
The second time I did say go. She got there. For sure.
Stop.
No, not stop at you. Oh, that's great. Thank you, Andy. I could never have set the scene like you do, and I really appreciate everything that you bring to this room and the expertise and the enthusiasm. I think a couple points that really stuck out to me with what you're saying is the idea that we can't work on top of each other, that we can't be fighting for the same pot of money without having an idea where collectively our priorities lie. And that is the main goal of our organization's advocacy sector, is to have collective action for our priorities to be your priorities, for them to be our priorities. And so in that light, let's look at where our priorities are. So when we polled everyone for the priorities in registration, we had a handful of categories come up. I had one of our incredible policy interns, Kevin Springer, who's not here today, do an analysis of where they ended up. So we're going to go ahead and see that 23.2% of the answers from this room, policy priorities laid within the hospital and healthcare delivery space. That is a very broad category, and I recognize that, but it's important to note that that is where a really big chunk of priorities laid, whether that was what deliveries look like, what hospital policies look like, and how we're addressing delivery generally. Maternal and infant mortality was about 4%. I like to think that almost every single one of these categories is going to lean to maternal and infant mortality, but for directly calling it out, we have 4% of the people in the room saying that. We also had 12.5% who specifically called out Medicaid and Medicare as large priority buckets for them as individuals or organizations. Specifically, a lot of people pointed out the impact of Medicaid's current state on pregnant and postpartum people right now, and so we'll dive into some of that as well. We looked into, again, maternal and women's health, really big category. Those were the language pieces that everyone used. We all have kind of a different way of saying the same things, but it's really interesting to see what kind of patterns exist in the space. We had 7% point out maternal mental health and substance abuse specifically. We had 14% specifically point out economic issues, that's government assistance. We're looking at things like TANF. We're looking at things like economic security of pregnant and postpartum people, of families generally. We had 4% specifically call out Healthy Start programming funding and uplifting that on the federal level. We had social well-being and support coming in with about 10%, incarceration at 4%, and about 11% of people specifically call out legislation or policies to support the expansion of doulas in our state. I also just want to point to, there were a handful of quotes that I pulled out that were a little bit more detailed that I wanted to point out. So expanding services for pregnant people and recently postpartum people to include social support systems, education, additional care for doulas, physical therapists, and mental health services. I think that quote specifically really shows how wide and how broad this category is and how many things we're really going to touch in this room today. When we previously have had the stakeholder meeting, the goal was to open up the floor and just hear every voice in the room. I know that I will be the kind of person that my voice is always heard. I won't leave a room without talking. It won't ever happen. But I also recognize that sometimes powerhouses are also quiet. And powerhouses have ideas that they don't always have space to share. There's about 70 people in this room. There's how many online?
32.
Hi, everyone. There's 32 people online. With 100 different voices, we really want to create a strategy that allows for space for all of your feedback. So there's a few ways we're going to do that today. I'm going to run through what I see as a policy outline. I'm not going to fall down while I do it. I will stay standing. I'm going to run through these. You have a notepad in front of you that has a breakdown of partners, of policy priorities, of coalition. If you see something missing from this information, fill it in. Who are the people you don't see in the room? or you don't see on the Zoom. Maybe coordinate with those people, see if they're on the Zoom, see if they're in the room. What are coalitions that you're sitting on that I don't have listed up here? And what are some specific policy priorities, like Andy said, that we can put into legislation tomorrow that you really want to see highlighted and uplifted by this group of people? I mean, with 100 people, we can do so much today, and there's going to be lots of different avenues to do that. So one is that notes. The second is everybody has some sticky notes on the table, and you can see here these policy categories on the side. These are the policy categories I'm going to walk through. Once we're done with the slide deck, we're going to pause. We're going to go put our sticky notes on the board. We're going to walk around the room. We're going to talk to each other. We're going to take a break. We're going to drink coffee probably. But we're also going to figure out where the gaps are, how we can fill them, and then we're going to come back together and talk through it. So I'm going to talk a lot in the next 17 minutes. It might be more like 27 minutes. It's going to be something in that range, depending on how quickly I talk. We will pause. Have your ideas written as you have them. Be thinking, be writing, and then we'll open for us to talk. So the first major category of policy legislation has always been a priority for our organization. It's been something we've really dived into as a coalition, as a partner group, and that's pregnant and postpartum workers. So pregnant people in the workplace, families in the workplace, and how we can support them when they show up in those spaces. So a really big win that we had last year was the federal policy for Pregnant Workers Fairness Act and the PUMP Act were both passed on the federal level. That is a pregnant workers accommodation policy that was really heavily supported by a handful of Georgia partners as part of the Georgia Coalition for Pregnant Workers. I see a lot of people in this room that were part of that initiative. Georgia was one of the few states that didn't have a Pregnant Workers Protection Act, which means that that federal legislation is impacting our state in a very different way than those who've already had these policies. So we're really focused in on making sure that there's awareness and effort around the implementation in the state. That means that making sure that businesses in the state are prepared for that legislation, make sure that there's a standard implementation policy, and make sure we're really tracking, is this policy working, or do we need to go back to the drawing board and have policies on a state level that really support these efforts? Another is expanding family medical paid leave for Georgia's mothers, fathers, birthers, and families across the state. We'll frame the space in just a minute here, but there are some key partners who are leading that work, and I see them in the room as well. So we'll dive into that a little bit more. Increase access and support for breastfeeding and expressing breast milk in the workplace across the state. Georgia had a really powerful breastfeeding law happen a few years ago, and so when the PUMP Act passed federally, it actually just brought the rest of the country up to where Georgia was. It's really interesting to start contrast between the Pregnant Workers Fairness Act and the PUMP Act, and the spaces that we've been leaders and the spaces that we really needed to step up, and that was one of them. But we're still really passionate about making sure that that implementation is going and programmatically happening in the state, as well as we're looking to expand bereavement for pregnancy loss in the state as well. So really making sure that there are policies that support families no matter what kind of pregnancy experience they have. Make sure that there's space for those experiencing pregnancy loss or experiencing pregnancy trauma that meets them where they really need while they're trying to enter and uplift the workplace and take care of their families. So we can frame the space a little bit. Miriam's gone. Will you hit next? Thank you. Okay, so
Sorry.
we can frame the space a little bit. These are two partners that have really been leading this work. A Better Balance is a federal organization that has a Southwest chapter as well. They were really key in the Pregnant Workers Fairness Act, and they're really focusing in on implementation, and they have a coalition of partners who are working towards that implementation. I think Cameron Dawson is on the virtual chat. It's okay if she's not, don't tell me, I'll be sad. And so we also have 9 to 5. I know Allison is here and a handful of other partners who are part of the Paid Leave Coalition that 9 to 5 is leading to lead paid leave efforts. So if you're thinking about pregnancy, you're thinking about pregnant people in the workplace, who are other partners that are really vital to this? Where are some other coalitions? Are there other groups across the state doing this work? Write those down, get your sticky notes ready. You'll be sticking them over there. I'm going to jump ahead to the next category, but we will circle back. We have a lot of time, I promise. So thank you, Kellen, so much. The next is the perinatal workforce. Those things feel like the same thing, and they're not. So increasing access, resources, and efficiency of the perinatal workforce. So when we're thinking about people who are serving people during the perinatal and postpartum period, who are doing direct service, we have a handful of specific policy recommendations, including providing a safety net for doulas, private and public insurance reimbursement avenues for doulas, for community health workers, We're focused on maternal health space, eliminating barriers and increasing integration for doulas, for midwives, and community health workers in the healthcare system. And when I go to the next slide from this space, Healthy Mothers, Healthy Babies does have a doula access working group that is specifically focused on hospital buy-in and on integration of doulas into the healthcare system in Georgia. That's led by our incredible workforce manager, Chanel Stryker, who I don't see here yet because I think they're having an event at the office, but they'll be here shortly, so you can talk to her a little bit about that. And then we also have Georgia Watch. Natasha Taylor leads an incredible community health worker advocacy coalition. I'll be honest, the space that I really feel like is missing from this, that may be a great thinking piece, is who's doing midwifery work in the state right now. When we're looking at the Supreme Court just overturned lactation policy that really opens up avenues for people to practice lactation support in the state. Are we making sure we're tracking the implementation of those constant changes in that space? So I would really love any feedback and ideas you have about how we can get more involved in those spaces, uplift them, and then really combine forces between all of these spaces and understand what the policy framework to support all of the workforce looks like. I feel like I can look at this side. Again, a really big category up there, writing your notes, writing your sticky notes, and I'll jump into the next one. Let's pause. Let's take a breather, because I'm seeing the word mental health and I'm like, I'm talking really fast. Something that is really important to Healthy Mothers, Healthy Babies is the idea that we're constantly talking about maternal mortality and infant mortality. We very often are not pausing to recognize that it is important to see families not just survive in the state. This is something, honestly, that when Kai says it really speaks to me, and I really try to just repeat it the exact way she does, is we don't want you to just not die. Like, we want you to be happy. We want you to be healthy in all things that help you. And health means more than just surviving. And so when we're looking at ways that we can support mothers, birthers, families in the state, we really want to make sure that we're focused in on their wellness, on their mental health. Employment is a really big piece of that, but there are other areas that we can make sure that we're uplifting, supporting, and giving spaces for joy in birth, in a space that can very often be very underserved, very traumatic in our state. It's a scary topic and it's a scary experience. And we want to make sure that we're creating policy avenues to support the joy in birth as well, and the happiness that can come along with that. So we really want to increase the representation of maternal mental health in all mental health discussions, in all substance abuse, and recognize that there may be a specific lens that we can be viewing some of these solutions to that support pregnant postpartum specifically. Another key piece of that is increasing reimbursements for pregnancy-related or associated mental health, not just treatment, but also screening, and also understanding that not every screening tool is made for every person in the state, and how can we make sure that we're capturing those who may go unrecognized by some of the systems that have been in place. Eliminating the incarceration of pregnant postpartum people and increasing options for diversion. That came up a lot in some of the feedback that you all provided. And then addressing and reducing maternal substance abuse and intimate partner violence. A lot of these solutions look like programs and resources, but we can't miss that there's a key policy piece to dive into. And I'm really interested in kind of framing this space a little bit more with who's doing the work on the policy side. So Healthy Mothers, Healthy Babies, a coalition of Georgia, and PSI Georgia has launched their perinatal mental health task force. Our first meeting was last month. We had about 50 attendees. There's significant in this room, obviously. And so, but we also have our next meeting next Tuesday. We really want to collaborate on where programs, resources, and research in this state is touching this area, and use all of that to come up with a comprehensive policy agenda that addresses maternal mental health and substance abuse specifically. So if you are not part of that coalition, please find me while we're eating later. And I will make sure to get you on that listserv, because it's a really powerful group already. And I think it's a combination of two spaces that, much like Andy shared, are extremely popular to talk about right now. And so I think creating some action in that space is really important and honestly very time sensitive. Other working groups, the Georgia Mental Health Policy Partnership is run by NAMI and the Georgia Council on Recovery. That oversees a much broader mental health discussion. But they do have maternal mental health as part of their agenda this year for the first time, which we're really excited to see. And then Maternal Substance Abuse Working Group is run by the Department of Public Health as well. It's another space that we're going to collaborate with. Again, if there's anyone missing from that list or any spaces that need to be added, don't just add them, come to the perinatal mental health task force and go ahead and get signed up. Another great contact person, I see Amanda Gorman from PSI is here, definitely lean on her if you have some ideas about that space. She's really helping to lead that work. Maternal oral health. This has been a priority for Healthy Mothers Healthy Babies for a long time. We recently launched our research study with Corey funded. One of our incredible research managers, Fozia Jama, is here. I'm not going to make her talk because I did not tell her she was going to, so I won't be doing that. But she is here and wonderful and truly becoming an expert in the maternal oral health space. Some of our policy priorities include reducing discrimination in oral health care, increasing provider knowledge about oral health care for pregnant and postpartum people, and specifically policy related is extending Medicaid to include oral health codes for pregnant people for 12 months postpartum. As we saw, pregnancy Medicaid expanded to 12 months, but we want to dive in and see, are we getting good comprehensive Medicaid coverage during that 12 months? And these oral health codes is a really great example of a space that seems overlooked in the maternal health space, but is really directly related to maternal health outcomes. So we were really excited to see the House and Senate include 27 of our requested codes in their original budget last session. Unfortunately, that did end up falling off the budget when the governor was giving his budget. So that's something that we're really coming in hot with again next session to understand what is the best avenue to get some of these oral health codes covered so that we're getting comprehensive care in ways that maybe we aren't just thinking about. What are the mental health codes? What are the oral health codes? What are the codes that providers need in order to be able to expand their services more widely to people in the state? Wow, it's almost like I planned those slides next to each other. Again, oral health, maternal mental health. Also, Medicaid unwinding is a really important topic right now, and understanding how do we reduce the impact of unwinding on the state of Georgia, on families, on pregnant and postpartum people, and understanding where that intersectionality between the expansion of pregnancy Medicaid and Medicaid unwinding and all of these things come together. As someone who is like supposed to be an expert in this space, like I don't really know the answers to a lot of the questions that come up in this. And so really gaming out where are some potential policy adjustments that we can make to support that space. Again, our oral health working group and supports our research, and Fozio leads that along with our board member, Dr. Irene Yang, and she's there, she is. Oh yeah, okay. We also, Voices for Georgia Children runs a Medicaid unwinding working group that is focused in on supporting Medicaid unwinding in the state. So I definitely is getting involved in that. I know a lot of people in this room are really ingrained in that work. I know Georgians for a Healthy Future has also been really pivotal in some of that work. And they also run a Cover Georgia coalition that addresses covering Medicaid expansion in Georgia state. So again, insurance is a big one. I'm sure there are things that I'm missing. I could probably think of them if I had enough hours in the day, but I don't need to because I have all of them. So if you have any other, like just even people that they need to be part of this discussion, don't hesitate to bring them down. Okay, we're almost done, I promise. So ensuring economic security and government assistance for families and for pregnant and postpartum people. So that includes ensuring adequate funding for the Department of Public Health's Maternal and Child Health section. That can include state and federal funding. And we're going to talk about ways that even today, this group of people can come together and make a list of federal funding priorities and be sure that we're advocating for dollars to not just be on our state to fund, and recognize that there's some federal attention on this issue as well, especially on Georgia representatives. And then also making sure that we're reforming and supporting TANF, WIC, and SNAP to more comprehensively support pregnant and postpartum people and families throughout the state. So there's a couple working groups in this space. Specifically, I know the Georgia Budget Policy Institute, as well as the YWCA, are partnering to really understand what TANF reform looks like. We had legislation dropped last year to address some of the TANF barriers, as well as the governor's TANF bill did expand this to pregnant people in the state. And so we really want to support those efforts. And if anyone's looking to get involved in that work, definitely talk to Ife, talk to Ashley, talk to Yosha. And then similarly, Voices runs a WIC working group as well to address WIC's priorities. That economic security and government assurance or assistance. Did I say assurance? Don't go back. Government assistance is a huge bucket. Like there's so much missing from the slide. and especially transparently, my slide deck is very maternal health focused. I know there are infant and child health priorities that are missing from this space, and I really want to dive into what those are, because that is a space that I think it is so important to recognize that we're all talking about a similar pot of money. And a lot of the confusion around some of these programming is that they sound like they do the same thing. They don't. And we need to make sure that we're educating those who are making policies and making budget decisions to understand that just because those things look like they're very similar programs does not mean that the state does not need them. And so recognizing where those holes, where those overlaps are, and collaborating over this. Oh, we're done. Okay. All right. So now we're going to frame the space a little bit. We're going to be doing it online as well with the Jamboard that Destiny's going to share, and there's virtual sticks galore there. But also now is the time to really drop your ideas. So your notes, your sticky notes. I see Kellen's got a lot of sticky notes. I'm really excited to see that. Each of these buckets exist. I'm also going to put up a blank one for anything where you're like, this doesn't fall in any of your categories. It needs to be a category. Actually, yeah, I'm done. And then we're just going to take 15, 20 minutes. We're going to put our sticky notes up. We're going to talk to each other. We're going to look at each other's sticky notes. We're going to brainstorm. We're going to walk around. We're going to say hi to people who got here and we weren't able to say hi to. And then we're going to come back at about 3:30, which is 23 minutes from now. So feel free to take a bathroom break, take a walk, take a stretch, and then we'll come back and see what kind of ideas came up and jump back. So transparently, I'm still trying to figure out the best way to really make sure that we're uplifting all the voices in the room. Instead of reading off every sticky note to you, I've kind of gone around to each table and seen if anybody wants the floor for a few minutes to talk about something that they're working on, something that's important to them that needs kind of this group's feedback and attention. So I've got a list. I think I hit every table. If you're like, you did not ask me that, just like come find me while I stand here while someone speaks and be like, I really want to talk, and I'll put you on the list. But I'm gonna kind of run through. We've got like 5 or 6 partners that I really want to give the space to really share what they're working on. So I'm gonna start with the person that I'm forcing to do this, and give her the floor. Amanda Gorman, because I wouldn't mind coming up here and talking a little bit about the training on the club task force and the work they do. Yeah, we can laugh. Yeah, you're on.
All right. So I took notes on a summary of what I saw over there. So I actually want to speak to that first. What everybody in the room collectively was saying, that in addition to what has Adam on the slide deck, are the things that we want to think about policy related to maternal mental health and substance use disorder. So access to treatment facilities, incentives to increase mental health providers, and also for those who accept Medicaid, increase pay to the mental health providers. Black maternal mental health, as we know that there is a large disproportion between different backgrounds, races, and ethnicities, specifically in Georgia. Promote awareness to reduce stigma of mental health substance use disorder in minority communities. Screening practices. So everybody needs to be screening. Are they using culturally competent and respectful screening tools? And this was mentioned on the slide, but I'll mention it again, reimbursement for screening to then incentivize providers to do the screening that a lot of them want to do and just simply have their hands in it. Maternal mental health peer support certification. This is a big one. Mental health support and prevention. So someone had written out on the note card something to the effect of mental health support before there's an issue. And I think that's huge. All providers who support pregnant and postpartum folks need education and training on maternal mental health. That's exactly what Postpartum Support International Georgia chapter has been focusing on since our inception in 2017. We want to provide training and education to every single provider in the state of Georgia, not just OBGYNs, but really anybody who's a provider working with families in the state of Georgia. And on that note, I think it's just important for us all to know and to acknowledge and to then keep talking to legislators about the fact that maternal health also encompasses maternal mental health, specifically to keeping pregnant people after birth alive. Suicide is the leading cause of maternal mortality and is up to 20% of the reason why people die in the postpartum period. So that's kind of my summary. Thanks for listening. Amanda with PSI Georgia.
Thank you so much, Amanda. I did not ask to summarize the sheet. I should have, so I'm really appreciative of you to do that. Next, I'm going to call up a Healthy Mothers Healthy Babies staff member who is leading our doula access working group. She's going to tell you just a little bit about some of the work that we're doing, and I'm going to open up the floor to Chanel Stryker.
Hi, everyone. My name is Chanel. I'm the Workforce Development Manager at Healthy Mothers Healthy Babies. So with that, I oversee our Building Perinatal Support Professionals program for the BPSP. If any of you know about that, we provide scholarships for doulas, childbirth educators, and certified breastfeeding specialists, and soon maternal mental health designations as well. We also provide continuing education, mentorship, and training to perinatal support professionals in the community. Through the Workforce Development Program, we also have our Safety Net Fund, which provides reimbursement to doulas to provide free support in the state. We also have a matching program through our BPSP program where we provide free support to the community as well, whether it be childbirth education, doulas, so on. And then I also oversee our Georgia Dual Access Working Group, where that Medicaid reimbursement pilot that some of you may know about as well, we had that happen last year to hopefully provide some sort of evidence and efficacy around why and how perinatal support professionals should be reimbursed. So we did that last year, and now we're working on integrating hospital buy-in, collaboration, provider awareness, community awareness around perinatal support professionals, what they do, who they are, and how they can support and be beneficial to the maternal health ecosystem. Thank you.
Thank you for letting me put you on the spot now. Another kind of sector of maternal health or the perinatal workforce, I'm going to ask Natasha Taylor from Georgia Watch. She can talk a little bit about community health.
Hello, everybody. I'm going to laugh. I always talk about community health workers, and yes. Community health workers are great. They're the plug, and we are going to keep advocating for community health workers. We are working to get community health workers certified in the state. That is one of our big priority initiatives, but something specifically in the space that as I also kind of walked and viewed the wall that I felt was missing is our hospital accountability framework that we're proposing. And I want to read something really quick from a Capital B News article. Shayana Alford called 911 when her water broke. She lives in this quiet town of 3,000 people tucked in the state's southwest region. It has no hospital or obstetric care. The county's ambulance service has also dwindled. The trucks are now dispatched from neighboring towns, and when the two they have are busy, there are no other ambulance services. On a July morning, Alfred waited while in labor for an ambulance that was 45 miles away. Once the driver hit the city limit, she waited for another half hour for him to find the house. His confusion resonated through the phone. I am not from down here. Down here, it is not my fault. Once they found her, it took another 45 minutes to get to the nearest hospital in Albany, which is Phoebe Putney. So Georgia Watch, and then particularly with the Wellstar closing in Atlanta, we decided to propose some hospital accountability framework to prevent destabilizing closures across the state. And we all know that there's a lot of conversation happening around certificate of need. So we'd like to call our framework certificate of don't need. There is a large, arduous process that people have to go through to open a nonprofit hospital. But there is really nothing that people have to do to close a hospital. So I can get you all copies of our framework. I will not take all the time kind of reading through it, but it does cover increased hospital closure oversight, which would incorporate communication with the Attorney General and DCH and other important stakeholders, increased hospital and hospital authority accountability. And I can spend all day talking about how hospital authorities typically don't have much accountability. Improved hospital authority governance, and then indigent and charity care spending requirements. As of right now, there is nothing codified, or there's no Georgia statutes around community benefit or indigent care spending. So I will be happy to share that framework with everybody. It's in a PDF that I can just send out to you. But that is really what we are trying to address this session that will help to improve maternal health outcomes, particularly in rural care deserts across the state.
Thank you, Natasha. I will now not say what I think anyone is going to talk about because I didn't ask those people. No, that's so fair. But another really important note that Natasha brought up is I will also be sending a follow-up email to all 100 people in person and virtual. So if there is items like their care plan or there's items like legislation that you really want to get this group's eyes on, send them to me and they will be part of our wrap-up email. I'm happy to house the responsibility of reaching everyone in the room, but also I'm happy to share the listserv of who attended today if you really want to send your own email. So just let me know what I can do to support kind of that collective action going forward. Next, I'm going to go ahead and ask Ms. Pamela Wynn to come up and talk a little bit about her organization and priorities.
Hello, everyone. I'm Pamela Wynn. I am the founder and president of Restore Her. Basically, we advocate on behalf of incarcerated pregnant. So what I bring into the space is, although we do all this great work around women and maternal health and all of that, we can't have a complete picture of what's really going on without including the incarcerated women that are also giving birth behind the walls. Our priorities have been based on my own lived experience of serving a 78-month federal sentence, being pregnant, chaperoned, which caused me to fall and lose my baby, passing HB 345 back in 2019, which bans the shackling and solitary confinement of these women, along with other things like squat and coughing, cavity searches, a lot of other very serious practices that go on behind bars that are a detriment to women's and babies' health. So since the passing of that, of course, data collection is also a big critical problem that we have with incarcerated women, period. I cannot honestly, or no one can, tell you how many women are incarcerated in the state of Georgia. We get data from the state, of course, but that data is not always accurate. And when it comes to the county jails, local facilities, and private prisons, we have not a clue how many women we have there or how many pregnant women we have in these places. And that has been a challenge. It was introduced in the legislation, the shackling legislation. We were opposed by the sheriffs and it was removed. It's always a challenge to get it. They're always fighting to remove it because it holds them accountable and liable for these women. So that continues to be one of our priorities. And because of those things, implementation of HB 345 has been pivotal to say the least, which of course I expected, and actually I'm not mad about, because now it puts us in a good position for our newest priority, and that is ending prison birth here in Georgia. Providing alternative sentencing for these women, and allowing them to serve their sentences after they have their babies, so they get autonomy over their birthing plans and how, what pregnancy looks like, how they want to deliver their babies, spending time with those babies, because of course, once they deliver babies here, there is no opportunities for them to breastfeed or even bond with those babies. And also family unification, because what they have within 24 hours to say who's going to be the caregiver of that baby, and if not, the state intervenes. So this is some very critical legislation to the mental health, the safety, and the dignity of these women and these babies. And so that remains our priority. But I'm excited to say we were able to get it passed in Colorado this year. And in Colorado, they added a number of alternatives, such as these women have up to a year that they can stay out before they have to return in. They get furloughs. They have opportunity for furloughs. They have opportunity for splitting their time where, for example, they may serve their time on the weekends, or things like that, where they're able to still be with their families, be present, and again, have autonomy over their pregnancies and their birth process. So those are the things that we advocate for in the work. Thank you.
Thank you so much, Ms. Kim. I am really excited to introduce our next speaker, who is a wonderful partner, Michaela Walker, to come up and talk a little bit about.
Hello, my name is Michaela, and I'm the Postpartum Warriors. And we focus on mental and physical illnesses postpartum. Sorry, I'm looking at this. I'm so nervous. I became an advocate after my own shows in 2020. I almost lost my life giving birth. I had some severe blood pressure issues. My blood pressure went to 246/130, and I ended up in the ICU. And I did not think I was going to be able to raise my son, but by the grace of God and my doctors, I'm still here. In 2021, I published a postpartum workbook entitled "Everything's Gonna Be Okay," and I want to thank Healthy Mothers, Healthy Babies for supporting my organization and putting my workbooks in the postpartum care packages. We support women and all birthing people to try to get resources that they need in their area, where they can, get it in their area, or if they can get a therapist virtually. Mental health is very, very important. I've struggled with postpartum physical issues because of my blood pressure, but my time in the ICU, once I was released, it affected me really bad mentally. And when I went to go get help for my mental health, I was turned away because I didn't have the correct insurance. Now, if I didn't have support from my family to take my baby while I was struggling, I don't know what would have happened to me or him. But I said, you know what? I'm not gonna let no other woman feel how I felt when they turned me away from that mental health clinic. And so that's where I am today. I advocate for women and birthing people for their mental health and physical health postpartum. I tell them the warning signs of physical illnesses. A lot of times people think that once you go home that you have made it and that you're safe, and that is not the case. It's truly not. But that's it. Thank you.
Thanks for sharing a little bit of your story, Kayla. I know that no one was expecting to really speak. I did ask everyone today, so it's incredible that you can kind of jump on telling your story like that. I know that's really powerful in spaces like this. Next, I'm going to call up a duo. Helen Wells and Polly McKinney. I'm not going to tell you what they're going to talk about because I have like 14 things that I could say and I don't know which one of them it is.
This is Polly and I's road show that we we only have to speak together now. It's there's strength in numbers, even if the numbers is two. So one of the big challenges that we're all facing across all sectors in the maternal and child health space is the loss of COVID dollars, COVID relief dollars, so the ARPA funding and the CARES funding that are running out. And particularly this is going to affect childcare. So we're losing a ton of funding that came down to the state. I think it was $1.6 billion that the state of Georgia received to kind of hold up the childcare industry. But we know that the childcare industry was in crisis before COVID, and the workforce has never recovered in the way that every other sector has. So programs are closing classrooms, and that means that workers don't have childcare and then can't go to work. So this is affecting the entire economy. So we are requesting that the state of Georgia invest at least $20 million in childcare in the CAPS program. CAPS is our childcare scholarship program, but it also kind of helps support childcare programs. So that's one of our big requests this year. That COVID relief funding is going away like this fall, like right now.
And just in case you're wondering, or even if you're not wondering, I'm going to say it anyway. About half of the CAPS dollars support school age kids. And so that, plus again, the loss of COVID for a lot of folks, a lot of school age kids who are siblings of babies, to give that parent, those parents, caregivers, some bandwidth in the summer and out of school. A lot of those dollars, millions, tens of millions of dollars are going away as well. And so there are a lot of us who are working in tandem to make sure that we can shore up childcare. And I'm going to jump to our next thing that is ongoing and is not as legislative at this point as it is advocacy related, and that was mentioned earlier this afternoon, is the redetermination process for every single human being on Medicaid. And that is huge, and it is in dire straits. So anything, it's not legislative as much as it is urgent. Like right now, anything that you can do to make sure that people check their mail, make sure that their addresses are up to date in Gateway, and reach out to the agency when they're supposed to, or even before, and also even after, if they get, like let off Medicaid, we can prevent a lot of the disenrollments with communication both ways. So that's urgent. Very urgent.
63,000 children lost Medicaid just in June.
And most of those are because the paperwork wasn't filled out.
So that's why community health workers are so important.
Yeah.
But we know that this is an ongoing, Medicaid redeterminations happen every year. They were paused during COVID, but they happen every year. So one of the long-term goals that Gears and Voices and others in the room have is to implement continuous Medicaid eligibility for young children so that we don't see young kids falling off Medicaid every year at their rate. Because that's when kids are going to the doctor, that's when they're getting their vaccines. Like, we really shouldn't see babies losing their coverage for 2 to 3 months because of that.
Well, and two other things along those notes is one, that a lot of women who were pregnant during COVID came on and the 12 months is up, but they've been allowed to stay on Medicaid. And probably, many I'm sure do not know that it in normal times is like predetermined. And so getting the word out to people who are past that 12 months to check their eligibility and to make sure that they have coverage in some form or fashion, or at least aware of what's happening, would be really helpful. And then I had another thing that Cal triggered in my brain. Community health worker. I'll shout it out from wherever I am in the car. Other stuff that I would say really quickly too is last year there was a great and fantastic effort from many of the folks in this room and beyond to get a home visiting pilot for 12 additional high needs counties. They got passed and funded, and a little piece of legislation that also supported that work. And so we'll be watching the implementation of that, as well as continuing to meet the band for state and federal dollars for home visiting programs in our state, because we know that those are huge in terms of infant and maternal health. Reimbursement rates you guys already talked about. And then the other thing I would say is there's a lot of conversation going on around children in foster care. Right now, it's a big hot topic. And while a lot of the conversation around generally older children who are being hoteled and where they're going now that they're not being hoteled and all of that, it is still really important to pay attention to small children under the age of 1 and also just little bitty people who go into foster care because of struggles with things along like social determinants of health, Maslow's hierarchy, things like housing, safe and stable housing, and things which are considered neglect, which families often struggle with, but yet still love their children and have a right to be with their children. And so a lot of us are working on issues surrounding all of that.
There's a pilot that's happening right now that Georgia State University is leading to bring in federal dollars that will support infant toddler courts. So children under the age of 3 will be kind of siphoned out of the typical dependency court process, and they will be those families, the goal will be pre-medication. It will not be the goal of whatever. And those families will be connected with more wraparound services and with mental health services. And in other states that have implemented these types of programs, we've seen higher rates of reunification, less out of placement time. So we'll definitely be keeping an eye on the implementation of that and thinking about sustainability and expansion.
And there's probably more.
Yeah, thank you guys.
Next, I'm going to invite Kelly Persons up. I don't have her down one, but I know you told me.
So I will be super quick. I'm Kelly Persons with the League of Women Voters of Georgia. One of these things is not like the others. And thank you for Madison for letting me come up here. I just want to, at every meeting we've been going to, want to remind people that voter purges are going on. People are actively being removed from voting rolls as we speak. They have 30 days to take action to get back on the voting rolls. So if you have a membership organization and you want to put something out about this, please know that I'm a resource. We can help come up with some social media, newsletter language, whatever you guys are looking at, because we also know to get some of these great policies passed, we have to have good policymakers in office at every level. So it directly impacts the work of everyone in this room. Thanks.
Thank you so much, Kelly. Also, get you a friend like Miriam. She comes over, she's like, your dad's calling you. It's probably fine, but do you want me to answer it? It's probably. He's retired currently, so he doesn't remember that like 4 PM is still a work day. I'm gonna call up just 2 more people and then I've got more announcements. I really appreciate all of our partners who are willing to speak, kind of take some of that off of me because I am tired and I really like hearing kind of all of your priorities and your own. So next, I'm gonna ask Allison Glass to come up and talk about me. I think.
Hello, everyone. Thank you, Madison, and Healthy Mothers for giving some space. Don't need my alarm to pick up children. They're taken care of today. So I am Allison Glass. I'm the policy and training manager for the Georgia chapter of 9 to 5. We are a national nonprofit that focuses on economic justice for women and non-binary people to be sure that folks have the supports that they need to stay at work. And we know that paid leave is an absolutely critical provision that folks need. We're so grateful to Helping Mothers, Healthy Babies, and several organizations in the room that are a part of the Georgia Coalition for Paid Leave, which 9 to 5 has the pleasure of leading for the past several years. And we're making a lot of headway. We're looking forward to picking up. Andy was so inspiring with the opportunity that we have right now. We feel like there's a great opportunity in our state right now to advance the provisions that we have currently around paid leave. So we were happy to support in 2021 the 3-week paid parental leave bill that did pass. Folks who are state employees and public school employees are eligible for those 3 weeks after childbirth or adoption or foster care placement. Amazing. 3 weeks is absolutely not enough. We want paid leave to be accessible for all workers in our state, public and private. And lately we've been getting phone calls from folks who work for our county departments of health that are like, wait, I thought I would be eligible for those 3 weeks, and they aren't. So that's definitely something that we're looking at, expanding at least the number of public sector workers who are eligible to use those 3 weeks. We would love for it to be longer. And then absolutely the long-term goal is comprehensive paid family and medical leave for all workers in our state, including folks who are undocumented, including contract workers, interns, all the folks, right? And so, yeah, that is what we are focused on. We're also looking at, because that family medical leave insurance fund is really of the 13 states that have passed good comprehensive paid leave laws. That is the method that they are taking. So it's a structure similar to disability insurance, where an employee and an employer would pay into the fund, and it would be there for when workers would need to access it. So that is the long-term solution for Georgia. So we're doing lots of education around that. Lawmakers are interested, but we've got, some short-term things that we can do in the meantime. So if there are folks here who would be interested in partnering, being a part of the coalition, giving us feedback, the maternal health space is such a critical advantage that we want to continue to center in this work. So thanks so much for the time.
Yeah, he wants to go to the Atlanta United Games. I've told him twice that I can't go to the Atlanta United Games. I'm gonna close this out with Gwen, you're our last speaker. Come on up.
In front of the projector and everything. I'm Gwen Gustafson. I work with GNR Public Health, and that's covering Gwinnett, Newton, and Rockdale counties. And so what I was just going to say, that I don't have a wonderful program that I'm going to go, this is what we work on, and these are our priorities, and this is where we're going with this. But I just wanted to bring up that one of the things that sometimes is not brought up in these meetings is what really is going on with our undocumented population. We look at, our vision in Georgia where every mother and baby has resources, and we know that those undocumented mothers don't have some of those same resources. And I know within our public health district, we are constantly trying to go to where these women are, meet them where they are, because there's, they just don't have the same access So we don't see them at so many of the same events and programs or doctors or midwives or whatever. It's just sort of an unspoken challenge, I think, that we all have in dealing with this. Of course, with the babies, you know, once they're born, they have access to Medicaid. You know, there are other doors that are opening up for them, avenues that are opening up for them to get the services, resources, care that they need. But with those mothers, it is a challenge. And I will tell you that we've had several people mentioning about the Medicaid redetermination. We're finding so many of our young kids who are born to parents who are undocumented, really having their Medicaid lapse be discontinued because of the challenges for those parents to really follow through with the whole redetermination process. So I'm just throwing that out there so that the massive amount of brain cells that are in here and the passion, that we can just kind of find some focus with that and just realize that is still a challenge for us as well. I don't know what the answers are, no matter where you stand on some aspects as far as documented or undocumented. We all love those mothers and babies, so we want them to be healthy and have their needs met. That's all I have to say.
Thank you, Gwen. All right, I have decided to give Polly 30 more seconds to speak.
I remembered what it was. And it was important, so I texted also. So what I remembered is that the feds are putting way back on funding for vaccinations for kids. And we are already like way behind in Georgia on making sure the kids birth to 3 or birth to 5 get the recommended vaccinations. And so we're going to be working on advocacy around that, as well as if we can find some, cash in a sofa cushion or something to make sure that we can pay for that. But that's something that is another thing I've asked you guys to just be aware of and advocate. You're welcome. Thank you, guys.
That actually brings me to what my next topic is. It's not the next topic on the slide, so don't worry, Miriam. We'll just leave it for space. Is that Healthy Mothers, Healthy Babies has decided to get a little bit more involved in the federal space as well. So we've seen in the federal house that the federal budget cut Healthy Start funding. That didn't happen in the Senate, and so there's still negotiations to be made. And that was brought to us by some partners to really trigger this idea of how can we as Georgia advocates really speak to what's important on a federal level to support our state, so that we're not, only working within those 4 months of session to figure out what our budget statewide looks like. So we have decided to draft a letter in support of Healthy Start funding, Head Start funding, Title V, as well as any other maternal and child health funding that our partners think is critical for the state of Georgia. So if you already have advocacy efforts around federal funding and you want to get those included, definitely please, that federal budget sticky note, go put it up there. I'm taking that down immediately, finishing the draft letter and sending it out to all of you first thing tomorrow morning. So we have a federal sign-on letter about something else that we'll talk about in a minute. It's just thanking people, so it's going to be a good balance. We're going to be like, thank you so much. So about budget. But definitely think about what else you want included in that priority letter. We're really going to try to get some collective action around that. The second federal assembly, I guess that feels wrong, but I'm going to go with it, comes back from their legislative break in August. When they get back in September, we will have information for them about what Georgia cares about. So federal budget page, it's looking a little empty. Fill it up. Next slide.
And the online Jamboard has other.
And the online Jamboard has one as well.
Shout out to the virtual people.
Shout out to everyone here for virtual. So the next really important thing I wanted to highlight is Healthy Mothers, Healthy Babies released early this month the maternal and child health data. So through this data hub, yeah. This data hub really is a reflection of what many of you may be familiar with, which is our 236 data. We really want to be able to take some of these maternal and infant health statistics and map them in a way that we can use for political advocacy. So that means that mapping these outcomes on a district level, so House and Senate district, and being able to pull the low birth weight, the access to prenatal care? Does your district have an OB unit? Does your district have a labor and delivery unit? That's something that the 236 tool has always been able to tell us, but now we're looking at it in a little bit more of a like math way. It's math now. That's all I got. You can see it from census tracts. You can see it from perinatal regions. You can see it from counties, or you can see it from your House and Senate district. Right now, we're mapping things like teen birth rate. We're mapping things like low birth weight babies, infant mortality rate. As I'm sure many of you know, maternal mortality is really difficult to look at such a specific level, but we're really trying to come up with ways to map maternal mortality and morbidity on top of this. On the piece of paper in front of you, there's a QR code at the very top that is our data hub. It's also on our Healthy Mothers, Healthy Babies website. In the interest of time and general just moving forwardness, I'm not going to pull it up and explore it with you now, but if you're interested in learning more about it, feel free to come talk to me or scan it and explore. If you have ideas of other data points that you think are important to map in this, we are working on building out phase 2 of this tool, as well as phase 3, which is going to include a lot more story mapping. So we're interested in your feedback. The data one looks a little bit more full than federal budget, but if there's other data pieces that you think could really help to tell this narrative from a more district specific level, put it up there and I will take it to our data experts. And we're going to try to really get some more information in this map so we can use it as advocates, we can send it to legislators, and also use it to educate and uplift the programs we're all working on. As well as grant writing. We be able to have those statistics. Next, federal legislation. So like I said, we're also going to be sending out a thank you letter. This specifically is going to go to Representatives Buddy Carter and Sanford Bishop. They recently, this past month, over the summer, dropped federal legislation called the Healthy Moms, Healthy Babies Act. I met with Buddy Carter's health staff for like 20 minutes about this bill, and I was just like, tell me about it. What is it? And then at the end, he was like, Healthy Mothers, Healthy. That's the name of the bill. And I was like, I know. And he was like, we didn't do that on purpose, right? And I was like, no, you didn't. It's catchy. But it's a really incredible bill. I took some time to read through it. It touches on looking at potential pilots and exploratory committees for looking at doula reimbursement. It also talks about, I'm just going to read this because I'm blanking, but it also talks a little bit about tracking cesarean rates. It's really data heavy on data transparency. Buddy Carter and Sanford Bishop have a bipartisan, it's bicameral, there's a Senate matching, and we really want to see some support around this bill because it touches so many of the priorities we talked about today. We also want them to know that we don't see this as like a signaling bill. Like we want you to go fight for this and push it. And so we really want to create a sign-on letter to say thank you, and we're watching what happens with this legislation, and please do something further with it other than right here. And so that being said, on your scanner here or up here, virtually, you should be able to scan it as well. If you could just look over the bill draft languages in there as well as the language of the letter. We're going to be getting partner sign on, and then I'm going to go ahead and drop these right in front of those legislators in the next time I go to the state, which who doesn't know, but we'll email it to you sooner. Next update, Maternal Health Awareness Day, save the date. It is, Miriam pointed out today, it is 12324. I know, right? It's kind of good. Last year was 12323, and we didn't think about it at all, but that's fine. So on January 23rd, Healthy Mothers, Healthy Babies will be hosting Maternal Health Awareness Day. Many of you were part of that event last year. We're going to be sending out information on what that day is going to look like, but it's going to include a lot of awareness building around our policy priorities, a lot of connecting constituents with their legislators, as well as, similar to last year, a press conference and some serious attention on how big the maternal advocacy space is. There are a lot of us in this room. If every single one of us invited 2 people to this Maternal Health Awareness Day, we'd have 300 people down at the Capitol talking to legislators about what's important to us. So save the date. I do not have a sign-in link right now, mostly just because I didn't. And so everyone's going to get an email with that sign-on link, but put that on your calendar today. It's an all-day event. We're going to be there. I'm going to be there from 8 to 5, maybe a little bit later. And so I hope you'll all join us. I'm also have one more really exciting event to share with you all, but I'm going to invite our Director of Development Communications, Daphne, up to tell us a little bit about our 50th celebration next year.
Hi, it's good to see you all here today. I just wanted to take this opportunity to share that we're having our 50th anniversary celebration next May from 7 to 4. If you've attended our annual meeting and conference before, it usually takes place in October, but because it's our 50th, we wanted to make it extra special. So we've expanded it to a 3-day event, 1 day dedicated to each of our pillars: advocacy, education, access to resources. And there are plenty of ways to get involved, anything from sponsorships to exhibitor tables. If you scan the QR code on the page, you can see all the ways to get involved. But I'm also available to chat if you have any questions. So feel free to do it. Thanks.
Thank you so much, Stephanie. There are lots of sponsorships available, including specific sponsorships for advocacy days. So if you're interested in those, definitely look up Daphne. And also feel free to ask myself, and I can go ask Daphne. I don't know the answer on a lot of those things yet. And we're really excited to bring everyone together in May as well. Okay. One more QR code, and then be free. Well, not free, but fun outside. Snacks and drinks free. It is our satisfaction survey. So here at Healthy Mothers, Healthy Babies, and I'm sure many of you would really want to start to evaluate our practices, evaluate our policies, and make sure that we're doing the best work that we can. So there is a small satisfaction survey. Shout out to Posio, because I texted her and said, can you make a satisfaction survey, and had this beautiful graphic and a QR code in my inbox in 4 minutes. And we want to see whether you felt like this event worked. We're constantly wanting to evolve and change. You can see the event this year was very different from last year. We want to know, do you feel like this was productive? Did you feel like it was fun? Would you do it again? And so definitely scan it here. The scan is on your piece of paper as well. I'm going to be honest, it's possible one of those 4 links doesn't work. I'm really hopeful they all 4 work. If they don't, tell me tomorrow. But give us your feedback. There's open comments. It should be anonymous. If it's not, I'll go change it right now. But you can go ahead and, or Posio will, I don't know. I didn't ask her to make it anonymous, so it's not her fault. It's not. But give us your feedback. Let us know what you think needs to happen with this kind of event going forward, so we can continue to grow as this wonderful group of stakeholders grows. So that is all I got. But not really. There will be snacks and drinks outside starting at 5. It is 4:27.
The drinks might be set up already, I saw.
Okay. It is an open bar. And so feel free to grab a drink, grab a soda, grab a water. There should be some cheese and meat